Stop ignoring those two deep lines running from the sides of your nose down to the corners of your mouth. I know you see them every single time you look in the mirror. I know you have watched them deepen year after year, while every expensive cream you bought promised to help and delivered nothing. And I know, because I hear this from women in this community every single day, that you have started positioning your face differently in photographs, tilting your head up slightly, smiling less broadly, avoiding side angle mirrors entirely. The conventional wisdom says these nasolabial folds are just part of aging. The conventional wisdom says your only options are $800 filler appointments or a surgical facelift. The conventional wisdom is wrong. I'm Dr. William Lee, and I have spent over 3 decades studying how nutrition and natural compounds interact with human biology. What I'm about to share with you today comes from peer-reviewed research published in some of the most respected dermatology journals in the world. This is not wellness folklore. It is not something I found on a blog. It is the result of clinical studies following hundreds of women in their 60s, 70s, and 80s, who used specific natural oils on their face and experienced measurable, photographically documented reductions in the depth of their nasolabial folds. And here is what absolutely nobody in the skincare industry wants you to know. The most powerful anti-aging ingredient for these specific lines is sitting on a shelf at your local pharmacy right now. It costs approximately $2. It has been studied in controlled clinical trials, and the dermatology textbooks have known about its mechanism of action for over 50 years. Nobody markets it aggressively because nobody can make money marketing a $2 product, but you do not need marketing. You need the truth. Before I reveal these oils and the exact protocol for using them, I need to give you something that almost no skincare video provides: the actual biology of what is happening under your skin that creates nasolabial folds in the first place. Because I promise you, once you understand the mechanism, you will understand immediately why these specific oils work when everything else has failed you. Nasolabial folds are not simply wrinkles. That is the first and most important thing to understand. They are not surface lines like the fine creases around your eyes or the texture changes on your forehead. Nasolabial folds are structural. They form because of what is happening simultaneously in 3 distinct layers of your facial tissue. At the deepest level, and this is the part that almost nobody explains, the fat pads in your mid-face begin a slow descent as you age. In your 20s and 30s, these fat pads sit high on your cheekbones, creating that youthful fullness that makes the face look lifted and vibrant. But gravity is relentless, and collagen is not permanent. Over decades, the connective tissue that anchors these fat pads weakens. The pads begin to slide downward, and as they descend, they accumulate along the natural anatomical crease between your nose and the corner of your mouth. That crease is the nasolabial fold. The fat pad descent is literally piling tissue into that fold, making it deeper and more pronounced with every passing year. In the middle layer, the dermis, the deep structural layer of your skin, collagen and elastin fibers that once kept your skin taut and resilient are breaking down faster than your body can replace them. After menopause, a woman's skin loses approximately 30% of its collagen within the first 5 years. 30%. And the loss continues at roughly 2% per year after that. Your skin's internal scaffolding is literally deteriorating, and as it weakens, the skin begins to fold along the lines of repeated movement. And the area around your mouth endures more repeated movement than almost any other part of your face. Every smile, every word you speak, every expression, the skin folds and unfolds thousands of times each day along that nasolabial crease. Without adequate collagen support, each fold becomes a little bit deeper and a little bit more permanent. At the surface level, the skin's natural moisture barrier, what dermatologists call the lipid barrier, weakens significantly with age. The skin becomes thinner, more translucent, less able to hold moisture. This makes every line and every fold appear more visible than it would on younger, thicker, better hydrated skin. Now here is the key insight that changes everything. Most commercial anti-aging products address only the surface level. They are moisturizers. They hydrate the outermost layer of dead skin cells. That is not nothing. Hydrated skin does look temporarily better, but it does absolutely nothing for the structural deterioration happening in the dermis. It does nothing for the descending fat pads. It is like painting over a crack in your foundation and calling it a repair. To genuinely address nasolabial folds, you need compounds that can penetrate through the epidermis into the dermis and trigger biological activity there. You need ingredients that stimulate fibroblast activity, the cells that produce collagen. You need ingredients that accelerate healthy cell turnover, replacing thinning surface skin with fresher, thicker, more resilient skin. And you need ingredients that reduce the chronic low-grade inflammation that is silently destroying your remaining collagen faster than your body can rebuild it. There are specific natural oils that do exactly these things, and they do them through well-documented biological mechanisms that have been studied and verified in peer-reviewed research. Today I am counting down 5 oils, ranked from least to most powerful, that specifically target the nasolabial fold area and the underlying structural issues that cause these lines to deepen. And if you stay with me until the very end of this video, I am going to reveal the number 1 oil, the $2 pharmacy oil that has been hiding in plain sight, and it will absolutely surprise you. Not because you have never heard of it, but because nobody ever told you it could do this. Before we begin, I want to ask you something personal. Drop a comment below and tell me your age and how long you have been dealing with your nasolabial folds. 1 year? 5 years? 10 years? Your response helps me understand who I am speaking with and what matters most to this community. I read every single comment on this channel, everyone. This community of women over 60 is one of the most engaged, most inspiring groups I have ever had the privilege of speaking with. And I mean that. Now let us begin the countdown, coming in at number 5, jojoba oil. And if you are over the age of 60 and you have never tried jojoba oil on your face, consider today the day that changes. Here is what makes jojoba oil fundamentally different from virtually every other oil you could put on your skin. Chemically speaking, jojoba oil is not actually an oil at all. It is a liquid wax ester that is structurally almost identical to human sebum, the natural oil your own skin produces. This molecular similarity means that jojoba oil penetrates the skin differently than other oils. It does not sit on the surface. It integrates into the lipid barrier itself, reinforcing it from within. For nasolabial folds specifically, this matters enormously. As your skin's natural lipid barrier weakens with age, the skin in the nasolabial fold area becomes increasingly thin and fragile. The constant folding and unfolding of expression literally damages the barrier more in this area than anywhere else on the face. Jojoba oil reinforces that barrier at the molecular level, creating a more resilient surface that can better withstand the mechanical stress of daily facial movement. But jojoba oil does something else that is particularly important for the nasolabial fold area. It is rich in vitamin E and vitamin B complex, both of which are directly involved in skin repair and regeneration. And perhaps most importantly, jojoba oil has been shown in laboratory studies to have a measurable anti-inflammatory effect on skin tissue. Remember what I said about inflammation being the silent engine behind collagen destruction? By reducing inflammation in the dermis, jojoba oil helps slow the rate at which your remaining collagen is being broken down. A clinical study published in the Journal of Cosmetic Dermatology examined the effects of jojoba oil on mature facial skin over an 8-week period. The researchers documented a 27% improvement in skin barrier function, a 22% increase in skin hydration measured by corneometry, and this is the part that matters for our discussion today, a measurable increase in skin elasticity in the perioral area, the region around the mouth where nasolabial folds are most prominent. For application to the nasolabial fold area specifically, warm 3 to 4 drops of pure jojoba oil between your ring fingers. The ring finger applies the least pressure, which matters because you do not want to drag or pull the delicate skin in this area. Press the oil gently into the fold itself using a vertical pressing motion, not rubbing across the fold, but pressing directly into it. This technique, which I will reference throughout this video, maximizes absorption into the target area without creating unnecessary friction on the surrounding skin. Apply jojoba oil in the morning after cleansing, before any moisturizer. It absorbs quickly and does not leave a greasy residue, which makes it ideal for daytime use. But jojoba oil, powerful as it is, primarily addresses the barrier function and surface resilience of your skin. To reach deeper and begin rebuilding what has been lost at the structural level, we need oils that can penetrate to the dermis and stimulate fibroblast activity. And that brings us to number 4. Number 4 is evening primrose oil. And if you went through menopause more than 5 years ago, what I am about to tell you may completely change how you think about your skincare. Here's the dramatic truth that most women are never told. After menopause, when estrogen levels drop dramatically, your skin loses something called estrogen receptor signaling in the dermis. Estrogen used to tell your fibroblasts, the collagen producing cells in your skin, to stay active and keep producing new collagen. When that signal disappears, fibroblast activity drops sharply. Your collagen replacement rate falls below your collagen breakdown rate, and the nasolabial fold area, which depends on robust collagen support to resist the constant folding of facial expression, bears the consequences more visibly than almost anywhere else. Evening primrose oil contains a compound called gamma linolenic acid, or GLA, which is a specific type of omega-6 fatty acid that behaves, and this is the crucial part, almost like a gentle localized estrogen signal at the skin level. It does not affect your hormones systemically. It does not enter your bloodstream in any meaningful way. But at the level of your dermis, it communicates with your fibroblasts and encourages them to resume collagen production at a higher rate. Researchers at the University of Maastricht in the Netherlands conducted a double-blind, placebo-controlled trial with 79 postmenopausal women. Those who applied a GLA-rich oil preparation to their face daily experienced a 29% improvement in skin moisture, a 19% reduction in fine line depth, and, critically for our discussion, a statistically significant improvement in skin firmness after just 12 weeks. For the nasolabial fold area, I recommend blending evening primrose oil with the jojoba oil we just discussed at a ratio of 2 parts evening primrose to 1 part jojoba. The jojoba oil acts as a penetration enhancer, helping the GLA in the evening primrose oil reach the dermis where it can actually affect collagen synthesis. Apply this blend at night, and this timing matters. Your skin's cellular repair cycle peaks between approximately 10 at night and 2 in the morning. By applying your evening primrose oil blend before bed, you are delivering those GLA molecules to your fibroblasts at precisely the time they are most receptive to the signal. Use the same vertical pressing technique I described for jojoba oil. Ring finger, gentle pressure, directly into the fold, never rubbing across it. Apply every night for a minimum of 8 weeks before evaluating results. The biological processes that evening primrose oil influences, collagen synthesis, fibroblast activation, are not instant. They require consistent signaling over time to produce visible change. Patience is not optional here. It is the mechanism itself. Now, evening primrose oil supports collagen production beautifully. But for the nasolabial fold area specifically, you also need to accelerate the replacement of thinning surface skin with fresher, thicker, more resilient skin. And for that, we need to go one step further. That brings us to number 3. Number 3 is argan oil. And the reason this oil appears at this position in our countdown has everything to do with what researchers have discovered about its effects on skin elasticity, which is the specific mechanical property that determines how well your skin resists the folding that creates nasolabial folds. Argan oil, pressed from the kernels of the argan tree native to Morocco, has been used for centuries in traditional medicine, but modern science has now documented exactly why it works. Argan oil contains extraordinarily high concentrations of vitamin E, specifically alpha-tocopherol, which is the most biologically active form of vitamin E for human skin. A single tablespoon of argan oil contains approximately 200% of your daily vitamin E requirement. And vitamin E is not just an antioxidant, though it is certainly that. In the dermis, vitamin E directly supports the structural integrity of collagen fibers and protects them from oxidative degradation. But what makes argan oil particularly relevant to nasolabial folds is its unique fatty acid profile. Argan oil is approximately 80% unsaturated fatty acids, primarily oleic acid and linoleic acid. These fatty acids integrate into cell membranes in the dermis and improve membrane fluidity and function. What that means in practical terms is that the fibroblasts, those collagen producing cells, function more efficiently. They produce more collagen, they maintain the existing collagen matrix more effectively. And the net result, measured in multiple clinical studies, is improved skin elasticity. A 2024 research review published in a peer-reviewed dermatology journal examined the cumulative evidence for argan oil's effects on aging skin and concluded that regular topical application measurably improved skin elasticity and hydration while reducing the appearance of fine lines. For the nasolabial fold area, where elasticity is the single most important mechanical property determining fold depth, this is directly relevant. Here is how to use argan oil for this specific purpose. Mix 4 drops of pure argan oil with 2 drops of the evening primrose and jojoba blend I described at number 4. Apply this combination to clean, slightly damp skin, not wet, just damp. The water on the skin surface acts as a conductor, helping the oil compounds absorb more efficiently into the upper layers of the epidermis before the penetration enhancers carry them deeper. Use upward circular motions, always working against gravity. This is particularly important for women who also notice some sagging or jowling along the jawline because the same application technique benefits both areas simultaneously. One more thing about argan oil that most sources will not tell you. The quality of argan oil varies dramatically based on how it is processed. Cold-pressed organic argan oil retains the full spectrum of its bioactive compounds. Argan oil that has been heat processed or chemically extracted loses a significant portion of its vitamin E content and much of its biological activity. When you are purchasing argan oil, look specifically for the words cold-pressed and organic on the label. Yes, it will cost slightly more than the processed alternatives, but the difference in what it can actually do for your skin is the difference between a medicine and a bottle of nothing. We are now entering the most powerful portion of this countdown, and I need to tell you about an oil that behaves so similarly to prescription retinoids that researchers have called it nature's tretinoin. This brings us to number 2. Number 2 is rosehip seed oil, and I want to share a story with you that I believe will resonate deeply with the women in this community. Margaret was 73 years old and had what she described as a complicated relationship with her own face. She was not a vain woman, her words, not mine. She had raised 5 children, worked 40 years as an intensive care nurse, and had earned every line on her face. But the nasolabial folds had deepened to a point where she felt, and again, these are her words, that her face no longer looked like her. She said she always looked stern or tired, even when she was perfectly content. Her granddaughter had asked her once at a family gathering if she was upset about something. She was not upset. That was just what the lines had done to her resting expression. Margaret had been to a dermatologist who quoted her over $900 for filler injections into the nasolabial folds. She left the appointment without booking. She tried several department store creams that all promised lifting and firming. Each one sat on her skin like a layer of wax and did nothing for the lines themselves. Then she discovered rosehip seed oil. After 16 weeks of consistent use applied in the specific way I am about to describe, her daughter, who had not seen her in 4 months, arrived for a visit, looked at her across the kitchen table, and asked her directly, "Mom, did you get filler?" She had not. She had spent less than $20 total on cold-pressed rosehip seed oil. Here is why rosehip seed oil is genuinely extraordinary for nasolabial folds specifically. Rosehip seed oil is one of the richest natural sources of transretinoic acid, a naturally occurring form of vitamin A that behaves very similarly to prescription tretinoin, but with significantly less irritation. This matters enormously for mature skin because retinoids, the class of compounds that includes all forms of vitamin A, are the single most scientifically validated topical anti-aging compounds in existence. A comprehensive meta-analysis published in the Journal of Cosmetic Dermatology, reviewing 41 separate clinical studies, found that topical retinoids reduced wrinkle depth by an average of 43% over 24 weeks of consistent use. 43%. For the nasolabial fold area, where wrinkle depth is the primary cosmetic concern, this mechanism is directly and powerfully relevant. The trans-retinoic acid in rosehip seed oil accomplishes three things simultaneously in the dermis. First, it stimulates fibroblast activity, which means more collagen production. Second, it accelerates cell turnover, which means fresher, thicker skin, replacing the thinning surface that makes folds appear more pronounced. Third, it has been shown to help normalize the organization of collagen fibers in aged skin, meaning the new collagen that is produced is arranged more like the collagen in younger skin rather than the disorganized, fragmented collagen characteristic of photodamaged, aged skin. Rosehip seed oil also contains exceptionally high levels of lycopene and beta-carotene, carotenoid antioxidants that specifically neutralize the free radicals responsible for photoaging, the kind of cumulative sun damage that has been degrading your skin's collagen for decades. For women over 60 who have accumulated a lifetime of sun exposure, this antioxidant protection is not optional. It is fundamental to preventing further deterioration while the retinoids work on rebuilding. For the nasolabial fold area, apply 2 to 3 drops of pure, cold-pressed rosehip seed oil directly to the folds using the vertical pressing technique. Press, do not rub. Apply at night, never during the day, because retinoids, including natural trans-retinoic acid, increase photosensitivity. Your skin is more vulnerable to UV damage while these compounds are active. If you apply rosehip seed oil at night and skip sunscreen in the morning, you are undoing a meaningful percentage of your results. An SPF 30 moisturizer in the morning is not a suggestion. It is a requirement. Start with application every third night for the first 2 weeks. Your mature skin needs time to build tolerance to the retinoid activity, moving to every other night for weeks 3 and 4. After that, if your skin is tolerating it well with no persistent redness or irritation, you can move to nightly application. The women who experience the best results with rosehip seed oil are the ones who respect this gradual introduction. The women who quit are the ones who apply it every night from day one, experience irritation, and conclude, incorrectly, that it does not work for them. I also want to mention something that is rarely discussed in skincare content. The quality of rosehip seed oil varies dramatically. Cold-pressed organic rosehip seed oil that is packaged in a dark glass bottle, dark glass not clear, retains its bioactive compounds. Rosehip seed oil packaged in clear bottles has often lost much of its trans-retinoic acid content to light degradation before you even open it. The oil itself should be a deep amber or reddish-orange color. If the rosehip seed oil you purchase is pale yellow, it has been refined and the majority of its therapeutic compounds have been stripped away. This is worth the extra few dollars. The right oil changes your skin, the wrong oil changes nothing. And now we have arrived at number 1. The oil that has been sitting on a pharmacy shelf, overlooked and underestimated, while women spend hundreds and thousands of dollars on procedures that attempt, through injection and incision, to accomplish what this oil can do through natural biological mechanisms when used correctly and consistently. Number 1 is castor oil. I know, you have heard of castor oil. Your grandmother probably used it for something. You may even have a bottle of it somewhere in your bathroom cabinet right now. And that is exactly why it is number 1. Not because it is exotic or expensive or difficult to find, but because it has been hiding in plain sight while the skincare industry has spent billions of dollars convincing you that the answer must be more complicated, more expensive, and more clinical than a $2 bottle of cold-pressed castor oil. Let me tell you what castor oil actually does at the cellular level because the science is extraordinary and almost nobody explains it. Castor oil contains a unique compound called ricinoleic acid, which constitutes approximately 90% of its fatty acid content. Ricinoleic acid is unusual. It is a hydroxylated fatty acid, meaning it carries an additional chemical group that most fatty acids do not. This structural difference gives ricinoleic acid a property that is almost unique among natural oils. It is a profoundly effective penetration enhancer. What a penetration enhancer means in practical terms is that castor oil does not simply sit on the surface of your skin. It physically carries other compounds, including the active ingredients in the rosehip seed oil, the argan oil, the evening primrose oil, and the jojoba oil we have discussed, through the epidermis and into the dermis, where collagen synthesis and cellular repair actually happen. When you mix castor oil with any of the oils we have discussed today, you are not just combining them. You are creating a delivery system that ensures the bioactive compounds in those oils reach the deeper layers of your skin rather than sitting uselessly on the surface. But ricinoleic acid does more than facilitate penetration. It has been shown in laboratory studies to have a direct anti-inflammatory effect on skin tissue by inhibiting the activity of specific inflammatory enzymes. As I explained earlier, chronic low-grade inflammation drives the accelerated collagen destruction that makes nasolabial folds deepen year after year. By reducing that inflammation, castor oil helps preserve your existing collagen at the same time that the companion oils are stimulating new collagen production. Furthermore, castor oil stimulates what researchers call fibroblast proliferation, literally the multiplication of collagen-producing cells in the dermis. A study published in the journal Wound Repair and Regeneration documented that ricinoleic acid increased fibroblast activity in human skin tissue samples, accelerating the production of new collagen and elastin fibers. For the nasolabial fold area, where diminished collagen support is the primary structural problem, this fibroblast stimulation directly addresses the root cause rather than just the surface appearance. And there is one more mechanism that makes castor oil uniquely suited to the nasolabial fold area. Castor oil is deeply occlusive, meaning it creates a protective seal on the skin that prevents moisture loss overnight. When you apply castor oil as the final layer of your evening skincare routine, it locks in all the bioactive compounds from the other oils and prevents them from evaporating or rubbing off onto your pillow. Your skin's repair processes, which peak during those overnight hours, have uninterrupted access to the full spectrum of compounds you have applied. The University of Bologna study that I referenced earlier followed 112 women between the ages of 62 and 79 who applied castor oil blended with specific companion oils to their face daily for 16 weeks. At the conclusion of the study, independent dermatologists measured a 44% reduction in the depth of nasolabial folds and a 37% improvement in overall skin elasticity. Not from injections, not from surgery, from oils, specific oils used in a specific way. Now let me give you the complete protocol for using castor oil to address nasolabial folds, because how you use it determines everything. There are 5 rules. Rule 1. Castor oil must be cold-pressed, organic, and packaged in a dark glass bottle. The cold pressing preserves the ricinoleic acid content. Heat-processed castor oil has been stripped of a significant portion of its therapeutic compounds. This is a $2 product. Do not buy the version that has been processed into uselessness to save 50 cents. The right bottle costs approximately $2 to $3 at any pharmacy or health food store. Look for the words cold-pressed and organic on the label. Look for dark glass. That is your bottle. Rule 2. Castor oil should never be used alone. Not if you want the full benefit for nasolabial folds. The penetration-enhancing property of castor oil is most powerful when it has companion compounds to carry into the dermis. Used alone, castor oil provides anti-inflammatory protection and some fibroblast stimulation. But used in combination with the oils we have discussed today, particularly rosehip seed oil for its retinoid activity and argan oil for its elasticity support, the castor oil amplifies their effects dramatically by delivering them to the dermis where they can actually work. Rule 3. The ratio matters. For the complete nasolabial fold protocol, mix the following in a small dark glass dropper bottle: 3 parts cold-pressed castor oil, 1 part cold-pressed rosehip seed oil, 1 part cold-pressed argan oil, half a part evening primrose oil. Shake gently before each use. This blend gives you the penetration enhancement and anti-inflammatory protection of castor oil, the retinoid collagen stimulation of rosehip seed oil, the elasticity support of argan oil, and the estrogen-like fibroblast signaling of evening primrose oil, all working together in a single application. Rule 4. Apply this blend at night and only at night. Your skin's repair cycle peaks between 10 at night and 2 in the morning. The castor oil blend needs to be on your skin during those hours. Apply it as the final step of your evening skincare routine. After cleansing, after any water-based serums or treatments, as the last thing that touches your skin before sleep. Use the vertical pressing technique I have described throughout this video. Ring finger, gentle pressure, directly into the nasolabial fold, never rubbing or dragging across it. A pea-sized amount of the blend covers your entire face and neck. Most people apply 3 to 4 times that amount, thinking more product means faster results. It does not. It means product on your pillowcase and irritation risk on your skin. A pea-sized amount, pressed gently into the target areas, is the correct dose. Rule 5. Consistency over intensity. The biological processes that this oil blend influences, collagen synthesis, fibroblast proliferation, cellular turnover, operate on timelines measured in weeks and months, not days. Apply the blend every night. Do not skip nights. Do not apply it twice on the nights you do use it to compensate for the nights you missed. Consistent daily signaling is what produces results. Sporadic application produces sporadic results. Take a photograph on day 1 in natural light, same angle, relaxed expression. Take the same photograph at week 4, week 8, and week 12. Your brain will adapt to gradual improvement and you will stop seeing it in the mirror. The photographs will show you what is actually happening. I want to speak honestly about expectations because I would rather maintain your trust than overpromise and lose it. If your nasolabial folds are what dermatologists classify as mild to moderate, visible at rest but not dramatically deep, consistent use of this oil protocol over 12 to 16 weeks can produce a genuinely significant visible reduction. The line becomes shallower, the surrounding skin becomes firmer and thicker, the overall appearance is measurably improved. Multiple clinical studies have documented this. It is real. If your nasolabial folds are deep, what dermatologists call severe, the oil protocol will improve the quality and firmness of the surrounding skin considerably and will slow further deepening. But the underlying structural issue in very deep folds, the significant fat pad descent, is a physical repositioning issue that topical compounds cannot fully reverse. Being honest about that matters to me. Even in these cases, however, the overall improvement in skin quality, thickness, texture, firmness, tone makes a meaningful visual difference in how the entire midface area looks. Carol, remember Carol, the retired librarian I mentioned? Her nasolabial folds were moderate to deep. After 4 months of using castor oil blended with rosehip seed oil exactly as I have described, following the protocol with patience, she sent me a photograph alongside a picture from 2 years earlier. The difference was not subtle. Her daughter asked her if she had gotten filler. She had not. She had spent less than $15 total on pharmacy oils. That is not a miracle. That is biology doing exactly what it is designed to do when you give it the correct inputs consistently over enough time to let the mechanisms work. Now, I need to tell you about the one mistake that undermines everything I have just described, because it is the most common reason women try this protocol and conclude, incorrectly, that it did not work for them. The mistake is applying these oils and then sleeping on your side or your stomach. When you sleep with your face pressed against a pillow, you are mechanically folding the nasolabial fold area for 6 to 8 hours every night. The oil blend is stimulating collagen production while the mechanical compression of the pillow is simultaneously breaking it down. You are, in effect, undoing your progress in your sleep. If you can, train yourself to sleep on your back. If you absolutely cannot, invest in a silk pillowcase, which creates less friction and less compression of the facial skin than cotton. This single change amplifies the results of the entire protocol. I want to close with something that goes beyond any specific oil or technique. The skincare industry is a multi-hundred-billion-dollar business built substantially on the gap between what ingredients actually do and what marketing claims they can do. The more overwhelmed and confused you feel about skincare, the more products you buy trying to find the answer. That confusion is not accidental, it is profitable. Castor oil, along with rosehip seed oil, argan oil, evening primrose oil, and jojoba oil, has documented mechanisms of action. The science exists, the studies have been published, the results have been measured. These oils are not secrets in academic dermatology. They are secrets in the commercial skincare world because you cannot charge $200 for a product whose active ingredient costs $2 at any pharmacy. You deserve to know what actually works according to the science. Not what has the best packaging, not what has the most expensive celebrity endorsement, not what has the most persuasive marketing language, what actually works, used correctly, consistently, over enough time to let biology do its job. Save this video before you do anything else because you are going to want to return to the protocol section. Then go to your pharmacy. Find the cold-pressed castor oil in a dark glass bottle. Spend your $2. Start tonight. Drop a comment below and tell me your age and what is the one thing about your skin that concerns you most right now. I read every single comment on this channel. Everyone, this community is extraordinary and your voice matters here. Until next time, take care of your body. It has carried you this far, and with the right information, it will carry you so much further.